What is irritable bowel syndrome? How do you get it? How do you treat it? And is this the number one gastrointestinal issue? Like, is that a blanket term for a lot of different things? What is irritable bowel syndrome?
Sure, I can talk about this. So irritable bowel syndrome is basically a syndrome of different symptoms. So people usually have abdominal pain. It's chronic. It can be associated with a change in their bowel habits, either a change in the form or appearance. And it's often associated with defecation. Either they'll get improvement in their abdominal pain after they have a bowel movement, or they'll get worsening symptoms when they're having a bowel movement. This is based on something called the Rome 4 criteria, discovered by Dr. Drossman. And irritable bowel syndrome is very, very common. It is the most common thing that gastroenterologists see in their GI practice, and I'm sure Dr. Laster would agree. It's also very commonly seen in primary care physicians. It's 1 out of 10 primary care doctors will see patients for IBS. So it's very common. And we think that it's related to gut bacteria abnormalities. In our GI tract, we have 500 trillion gut bacteria. We have good bacteria and bad bacteria. And when that bacteria becomes imbalanced, we get something called gut bacterial dysbiosis. And that can lead to something called gut bacterial permeability, what a lot of people in the lay population call leaky gut. And we can talk more about this, now or later if you want, but really we have a very thin layer of epithelial cells that separates what's in our GI tract and in our gut from what's in our blood. It's called the gut blood barrier. And it's really important that that thin layer stay intact. If that thin layer of epithelial cells becomes intact, either from an infection, harmful pathogens, harmful bacteria, then we can get a whole host of other medical issues, and IBS is thought to be one of those. We used to think that IBS was a psychiatric illness and a psychiatric issue because, the symptoms can be a little bit vague, and it can be really frustrating for patients because there's no one test that is going to diagnose IBS. It's not something that you can see a primary care doctor, you can see me as a gastroenterologist, and I can order a lab test, blood work. It's not going to happen. Nothing will come positive. Your blood work will be normal. Any imaging, CAT scan, ultrasound, it'll be normal. You might have a colonoscopy, upper endoscopy, that will also come back normal. So it's very frustrating for patients. And like I said, we used to think it was the psych issue. They were maybe making it up. We know that's not true at all. We know that there's a gut microbiome issue. We also know that there's something called visceral hypersensitivity. Patients actually experience more pain, heightened pain. They're feeling pain. There have been research studies looking at this. There have been studies where they put a rectal probe in people's bottoms, and there's a balloon at the end, and they'll fill the balloon up with saline and air, and they'll ask patients, healthy patients and patients with IBS, and they'll ask them, tell me when you're starting to experience pain and discomfort. And the studies have shown that patients with IBS consistently have pain and discomfort at an earlier point than healthy patients. So, we know that the pain is real and it's very frustrating for patients, but we think it's related to the gut microbiome, the foods that we eat, and also stress. I mean, we know there's a lot related. Stress, alcohol, all of those things play a role. I mean, I actually gave like a 2-hour lecture on this today, so I could keep going on. I don't want to take the whole time, but one of the other things just to think about is with irritable bowel is, there is a brain-gut connection. And so if we are stressed, anxious, and worried, that will most definitely affect our GI tract. So not an easy answer. I tried to summarize it briefly. Hopefully that helps.
I'm not sure if it's against the rule for panelists to ask another panelist a question. Do you read stool samples in your patient with IBS? Do you use stool samples in your practice?
So we do stool samples. I guess it depends what type of stool sample. So in patients who have, or I'm thinking about irritable bowel syndrome, and they're coming in with diarrhea, for example, I mean, it is important that I rule out other issues. I want to make sure I might check stool samples looking at inflammation. I might check stool samples just to make sure they don't have any infection. I might look to make sure they don't have pancreatic insufficiency causing diarrhea. So I do those type of stool studies. I do not do stool samples looking for, specific gut microbes, because really, I don't believe that the GI literature supports that at this time. I think that it's not validated yet. And I really don't know what to do if patients, they do these tests and they bring them in and they tell me that they're high in very specific strains and low in specific strains. And I don't know what to make of that right now. Because really, okay, I can see your gut microbiome is unhealthy. And I probably could have told you that without that stool test. And my treatment for a lot of those things is often diet, whole food, or plant-based, or having more fiber, and lifestyle changes, reducing stress. So I do not routinely check for gut bacterial strains.
But would there be a before and after change you would expect to say someone had a bad looking stool and they got on a healthy diet? Would you expect certain changes or not?
In the research, we are seeing that. We are seeing that patients who are on a plant-based diet versus an animal-based diet, there's gut microbiome differences. We are seeing people that when, if you take a stool sample before, like on a normal diet, and then they switch to a plant-based diet, we are seeing gut microbiome changes. And the answer to all of that, just to kind of key in, is that the gut microbiome does seem to improve when you're on a plant-based diet. And the gut microbiome, the harmful bacteria gets worse on an animal-based diet. The research studies show that when you're on a plant-based diet, we do see more diversity of bacterial strains. That's important. And we also see more of the healthy bacteria. So it's also important. So there are research trials on it. I think in the future, we will be doing those type of testing, but there's not enough for me to recommend. The GI guidelines do not recommend routine testing. So we're not there yet, but as more and more research comes, I think we will be able to identify which strains are going to be important. And then eventually, maybe we'll be able to target that a little bit more. But routinely, we're not there now, and the GI guidelines don't recommend it.
I could not agree with her. I want to just send this and just put this up for all patients. I think the one piece that if people who are listening who have IBS or struggle with sort of GI symptoms is so many patients are so frustrated and they go to see so many gastroenterologists, and I'll have patients that I am number 17 and they're coming in sort of demanding another upper endoscopy, another colonoscopy. And they don't want to hear about sort of dietary changes and stress relief and sort of, mind-gut connections and these sort of things. And so it takes you a little bit of time to sort of create that bond so people can hear you as well, because they come in with their binders and they are ready sort of to go to war with us, right? But it's super important for patients to understand that we believe you, we hear you. You are 85% of what we see every single day. And it's really so much about sort of that mind-gut connection. And the one thing that she mentioned earlier that I absolutely love, and I go through sort of I nerd out with patients a little bit to get them to sort of understand this is data on a lot of this stuff, but that thin layer is super important. And there's been data that shows us that the more this is my, spiel to get them on my decreased processed food sort of train, is telling them that this leaky gut everybody sort of reads about. What we care about in GI is making sure that sort of that lining stays intact and you don't have sort of that penetration there. And so what studies have shown us is that processed food does just that. Processed foods ruin, kind of change your diversity and their small bowel. Your small bowel goes, I don't know what to do with all of these emulsifiers and additives. And so therefore it's going to have more inflammation. You get more bloating, more abdominal discomfort, more food intolerances, which we also see a lot of, as patients will say, well, no, I can't eat a salad. I just can't eat fiber. I can't eat these things. And that's because we've created a microbiome in which your gut is unable to process those things. And so explaining to patients, I sort of explain it to them as like, we trying to garden here. And if you can't plant a garden with, Doritos and Mountain Dew, nothing's going to grow there. And trying to get patients to understand sort of from that perspective, what we mean by a whole food plant-based diet. And the other thing also I'm like, we all see the same patients clearly. They must come from DC and go to Delaware because they come in with these stool tests that they've gotten from some person, but they want us to interpret said stool test. And there is there's no guideline for that. We can tell you it's the same thing. When you come in, I know you have a disordered microbiome. You tell me what you're eating, we talk about your diet. I know that. I don't need those stool tests to tell me. And I know it's also going to change by us getting you on more fiber, more unprocessed foods, more whole grains, actually drinking some water. And so that's one key take home for anybody that's watching that has IBS is we do believe you. We know that it's real, and we're not trying to keep away some secret from you when we talk about sort of changing sort of diet, getting sleep, and sort of reducing stress, because it's all very real.